quick introduction here. I'm Jeff Brockner. I'm a senior product manager here at Capital RX. I work in Capital RX's development team on Judi adjudication, which includes claims processing, benefit setup, and user interfaces, with a focus on government programs. I've been working in pharmacy claims and PBM really since the Medicare Part D program started in 2003 when the law was passed. Jillian, do you want to introduce yourself?
Sure, thanks, Jeff. Hi, everyone. My name is Jillian Lonson, Senior Director of Benefits Administration and Operations here at Capital RX. And my area is responsible for benefit plan design, configuration, and testing for both new client implementations and existing clients that may request changes for their upcoming plan year. We also work very closely with Jeff's team to define any new requirements, and once they are configured in Judi, my team is responsible for the front-end QC and testing. I have nearly 20 years of experience in pharmacy, both as a pharmacy technician working in retail, with the majority of my career being in the PBM and pharmacy consulting industries. So the topics for today, we're going to walk through the history and background of legacy systems, inherent limitations of legacy claims processing systems, the key features and differentiators of Judi, and then we'll wrap up with a Q&A session. Jeff, I'll turn it over to you.
Great, thank you, Jillian. So we've learned a lot from history. It's sort of hard to believe that 100 years ago, the healthcare industry kind of starts. In the 1920s, when Henry Kaiser started charging workers and their employers 5 cents a day for access to his hospitals for the treatment of illnesses and injuries. Also in the 20s, Blue Cross started charging $6 a month for 21 days in the hospital. And Blue Shield started charging $6 a month for medical services through group of physicians. Medicare and Medicaid, of course, become law in the 1960s, and paper claims are the standard with the HCFA 1500, a form that's still in use today, the CMS 1500. HCFA changed the form to red ink in the 1990s to promote electronic scanning of claims forms. People might remember the OCR, the optical character readers, to help speed up claims processing. The first pharmacy benefit starts in 1968, when a company named Pharmaceutical Card Systems, PCS, started adjudicating paper pharmacy benefit claims, or pharmacy claims. PCS starts electronic claims processing in the 1980s. NCPDP publishes the first pharmacy telecommunication standard in 1988. CMS names the standard a HIPAA transaction standard in the early 2000s. Systems Excellence, SXC, is formed in 1993, a Canadian company. SXC is one of the first companies to build technology used in pharmacy benefit management. Today, PCS is part of CVS Caremark, and SXC is part of Optum or United Healthcare. They focus on PBM services, much of which is outside of claims processing. Services like care services, population health, healthcare delivery, mail order, and specialty pharmacies, infusion services, and more. Both organizations are $200 billion organizations today. Of course, PCS and SXC have updated their systems over the decades, but for the most part, these systems still use mainframe or AS400 type platforms to do core adjudication functions such as claims processing and benefit programming. Probably everyone on this call, including myself, has worked in one of these legacy systems. It's hard to find the information you need. It takes a long time to set up benefits, and changes often require lengthy programming and implementation cycles. For health plans asking for special customization, you may never get what you want. Jillian, do you want to describe some of the limitations you have found with these legacy systems?
Sure, I'd love to. So what are the limitations of these legacy systems? Well, the overall user experience in navigation and flow of legacy systems can be confusing. There's typically multiple screens and an AS400 interface, as Jeff had already alluded to. There are challenges when it comes to researching claims to determine the cause of an end result in question, or determining the root cause of an inaccurate benefit design. There are multiple lists that are necessary to drive custom rule sets and prioritization to target a specific set of outcomes. The time to run batch testing is typically measured in hours. The manual loading of benefit updates is common and can typically take an extended period of time. Anytime there's a manual component, this allows a greater risk for human error. Multiple plan codes are needed to drive accumulation buckets based on different coverage types, such as a cardholder or cardholder plus spouse or dependent, or even a family. This also means that the maintenance is more demanding as the user has multiple plans to manage year over year. Legacy systems typically have separate platforms for various areas such as clinical, formulary, reporting, accumulators, and even finance. Customization is a challenge, especially when it comes to prioritizing specific rule sets when there are competing or overlapping priorities or rules. Testing is performed in a test environment, which does not mirror a production environment one-to-one. This allows opportunity for adjudication errors in real time. Test members must be created in the system to then have them purged out when you may continue to need them in the future. This also means a user needs to recreate or recall a variety of test members and their demographics for specific scenarios. Legacy systems typically require the use of hotkeys, which can be confusing to users. Formulary updates typically require prioritization to make changes. Member level overrides, they are typically complex and require back-end key or really archaic logic to decipher. Medicare plan designs require updating the annual CMS values year over year across hundreds, if not thousands, of benefit designs. Enhancements could take months to complete if they ever get in a queue to be completed. There are limitations around implementing changes on the fly and prioritizing enhancements for smaller customers. Claims research is typically daunting, requiring the user to work with multiple areas and screens and lists to determine the root cause, as it is not easily apparent in these legacy platforms. There are really so many unique features of Judi that we could spend all day talking about them, but let's move into talking about some of the highlights of Judi and what Judi can do. Jeff, I'll turn it over to you.
Great, thank you, Jillian. So you know the old saying that, if I knew then what I know now, I might do things differently. Well, at Capital RX, that's exactly what we have, is the opportunity to apply what we know now from PBM history and using these systems and build a better system to administer pharmacy benefits. We're going to use some things like configure, not program benefits. We're going to surface options and parameters for users. We're going to present the users with data in an organized, visible, easy to use way. We understand this because we've been part of this community. We've been doing this for a long time. Judi displays the right details to get work done, whether you're a call center associate or a customer or a member or a plan manager, a clinical administrator or network administrator, or even sales. It's going to present data to you in a way that you can use and you can help, like in customer service, you can answer those calls for the members. Judi is modern software. It's an application that takes advantage of current technology. It's a cloud-based, Judi is a cloud-based system. What that means is that Judi has on-demand availability of computer system resources, especially data storage and computing power. At Capital RX, our product teams understand the journey, a person's journey through the software, and we built user-friendly software, easy to use, regardless of the platform you're on. Whether you're on a PC or a tablet or a phone, your Judi experience is going to be the same. Some of my favorite features. Judi is easy to navigate and find the information a user needs, such as member information, claim information, eligibility, benefits, and accumulations. It's easy to view Medicare members and Medicare claims information. Not only is the claims adjudication available when you click on a member, but you can see associate those claims, the PDE records, any NX transactions that are associated with that claim, any FER accumulations that are associated with that member, as well as their accumulation. All member eligibility flags are also easily visible, such as low-income subsidy, ESRD, or transplant indicators. Judi's benefit configuration has workflow to navigate the benefit configuration. So as you're going through configuring a benefit, it walks you through cost sharing and networks and formulary and utilization management, lets you set fill limits and safety and transition filling parameters. All of these are configurable without programming within Judi. when a user chooses to configure, let's say, a Medicare benefit in Judi, the Judi pre-configures all the attributes of troop and drug spend, low-income cost sharing, the defined standard benefit, and the phases. They're all pre-configured in Judi. One is left to configure, let's say, an MAPD enhanced alternative plan or an EGWP benefit. You put those cost shares in, and you put the things over top of the defined standard, and this streamlines the process greatly. You can be ready to test an MAPD plan in 15 minutes in Judi. We talk a lot about claims processing because I think Jillian and I both spend a lot of time in claims processing and benefits, but I don't want to give you the impression that Judi is just claims processing. This is an integrated platform, integrated databases and integrated data. It's a comprehensive platform for pharmacy benefit management. Judi has a dozen or so modules. So we talk about claims and member views. There's plan management for setting up benefits. We have our own formulary management application that's integrated into Judi. We also have a prior authorization tool we affectionately call PAT that's integrated into Judi. We have a test application where one can go in and do either single test claims or batch test claims. A call center or member can run test claims with one click of their mouse. They can create a test claim. We have a reprocessing module with a little bit more than 8 reprocessing types, whether you're reprocessing Medicare for retroactive licks, like type of things, or commercial reprocessing, or for audits. They're already built into and integrated into Judi. As I mentioned, we expose the financial information reporting or FIR transactions as well as the NX transactions, so users can view those. Pharmacy network application and pricing application. I think we have a handful of folks here at Capital RX who think this is their favorite place to live because they live quite a bit in network and pricing, a key component to most PBMs. We have a DMR application and manual claims adjudication. So if you do need to do those paper claims and a direct member reimbursement, we have an application for that. Well, we have clinical programs, drug management programs, and utilization management tools within Judi. The management actually houses the Medicare Stars dashboard, which is a real-time dashboard that users can go in and see where they land on their stars throughout the course of the year. We have other real-time claims dashboards, as for instance, we have it's a little kitschy, but we have a map of the United States. And if you're looking at that as a customer, there are little dots pop up in real time to show you where your claims are being paid and how many claims are being paid on a real-time basis. And it keeps accumulating this as you look at the map. We have data outputs and reporting modules. We affectionately refer to as DORA, our data output and reporting module. It's a user-friendly form for reporting information where you can do things either ad hoc or schedule things for monthly or quarterly reports, already built into Judi. Another area that's often one that can be complicated with legacy systems is data exchanges. So we have data exchanges and eligibility modules. These are utilities for exchanging data with Judi and other third parties or with our plan sponsors or with our customers. We have financial performance reporting, which includes performance modeling and an underwriting, so that sales might be ones using underwriting modules, operational modules for the creation and sending and monitoring of PDE records and counter files, plan finder files, and more. And then, of course, there are some overall utilities in Judi that only a few people do, but the identity or who logs in the access modules. So we've already built in all those sort of things. So that security, always a big part in our industry, has its own module. I could go on about more things, about test claims, about our drug card program, coupon program, the integration of PQA data, fraud, waste, and abuse program that's built into Judi, how we do time travel with accumulation, so that you can look at accumulation via any date that you choose for a member. But I'm going to ask you, Jillian, what are some of your favorite features of Judi?
Thanks, Jeff. So as someone who has worked in legacy systems for the majority of my career, I truly appreciate that Judi pre-configures Medicare plan benefits with the defined standard values for that calendar year. And this is tested well ahead of time to ensure ample readiness for the new year. Complex benefits, as you mentioned, such as MAPD enhanced alternative plans, can be configured and ready to test in 15 minutes or less. Bulk actions for both uploading and downloading entire benefit configurations. This could be one update across hundreds of benefit designs or hundreds of updates across thousands of unique configurations. It really doesn't stop there. Judi can also bulk action load member level overrides, custom rule sets, networks, formulary elections, clinical rules. Really, the list does go on. If a user can manually enter it into Judi, it can also be batch loaded directly into Judi as well. Smart tags and overrides. We are able to configure custom rule sets without any programming required to dictate any outcome, and there is no need for rule set prioritization. The nice thing about tags and overrides is that they also appear on the outcome of a claim. So the user can tie back the reason why the claim adjudicated as it did. This is especially helpful when it comes to claims research, which I'll discuss here shortly. Lastly, batch testing can be performed in less than 10 minutes for 700 or more unique scenarios and return a pass-fail end result. It is a simple upload and then download when testing is ready to be retrieved and reviewed. The ability to test in a production environment minimizes potential disruption as there is no lag in platforms needing to be updated. Additionally, testing in a live production environment in Judi does not impact live claims processing with our ability to post-date configurations and batch testing scenarios. What makes Judi different than legacy systems? Well, Judi's user interface really allows for a seamless flow when configuring both clinical and non-clinical benefit rule sets. I like to say that if I told my 11-year-old daughter to build a benefit with our one-to-one workflow reference, that she could do it with minimal oversight because Judi is really that self-intuitive. I want to bring your attention to the graphic on my screen, as it is one of my most favorite features of Judi. It is called Adjudication Reasons, and it tells the user a story of a claim's outcome, which almost acts as like the Cliff's Notes version of why a claim processed how it did. This is especially helpful for researching claims to determine root cause of an unanticipated outcome, or to just better really understand how a claim processed in Judi and all the rule sets that influence the outcome of a particular claim. It really does walk you through each step a claim makes from start to finish. Batch testing, whether it's 50 or 5,000 unique scenarios, takes less than 10 minutes to achieve. Access to all modules within one system, as Jeff previously explained, such as network, formulary, clinical rule sets. This allows a user to stay in one platform and have access to all the areas without having to remember multiple usernames and passwords. The ability to load hundreds of benefit configurations via our bulk action capabilities within minutes. And lastly, Judi's ability to test in production without impacting real production membership or claims, as I previously alluded to. So when we compare Judi to legacy systems, there's really no comparison. I cannot say it enough. As someone who has had many years of experience in legacy platforms, Judi is really like a breath of fresh air. You all know my love for the reasons for adjudication, which I just highlighted, which really just allows users to know exactly how a claim processed in Judi and why it processed as it did. We do not need to spend hours and communicate with multiple areas to figure out why a claim processed like it did or how. Bulk actions. Judi has multiple templates to choose from to load a variety of actions, whether it's an entire benefit configuration or just a simple cost share update. You simply enter the value you want to change, upload, and within seconds, you have all your updated rules available to view immediately in Judi. Tags and overrides, another one of my favorite features when creating very targeted rules to influence an outcome. Some of our larger health plan clients have physician gold carding programs in place, of which a subset of medications, when prescribed by specific providers, are to bypass prior authorization criteria automatically, and then stamp the claim for easy reporting. This was accomplished in Judi within minutes, just one of the many use cases when it comes to our tag and override feature. Benefit configuration testing. With legacy systems, clients really have no way of testing on their own. They must wait for the PBM to provide testing outputs or results, whereas Capital RX can easily provide health plan clients the ability and option to perform their own batch testing. Ease of implementing custom benefit configurations and changes in Judi truly takes minutes, even with very unique and targeted criteria and requirements. Jeff, I'll turn it over to you.
Thank you, Jillian. So even though Judi is complex and comprehensive software, and Jillian did a nice job describing some of those things that we can do in Judi very easily, I really like the speed of our organization here as well. And here's an example of our readiness and our software development speed. When the Inflation Reduction Act requirements came out, plans were required to record an IRA subsidy amount for vaccines and insulin and add that subsidy amount in the PDE records under other troop and add a new indicator to indicate that that other troop amount was a subsidy amount. So in Judi, on the claims record, we added 4 fields. We added a Inflation Reduction Act covered vaccine indicator, again, an indicator for easy reporting. We also did an IRA indicator for insulin as well. We added the inflation reduction subsidy amount and the calculation to calculate the IRA subsidy. And then we updated the values that were allowed within the true out-of-pocket amount indicators. We added the S and the B as it was required by CMS. So we updated and tested point of sale for these IRA rules. The guidance came out on September 26th, and Judi was production ready on October 31st. We had thoroughly tested the code. We had done code review and functional testing, QA testing, batch testing with production benefits, stakeholder testing, and automated back-end and front-end regression testing. The new function was live in Judi 2 months ahead of the deadline, the statutory deadline of 1/1. But more importantly, it was also ready 6 weeks before CMS came out with their December 12th HPMS memo asking plans if they were ready, how plans must report any issues with their IRA calculations to CMS, and how to provide members refunds in the first quarter for overpayments because of the lack of readiness. Our customers had no worries about this CMS deadline. We were already complete with the version. It was already in production. So they didn't have to worry about any members complaining. They didn't have to worry about pay and chase with members or refunding overpayments. This is typical for Capital RX, not the exception. The flexibility of Judi's modern architecture makes this speed possible. These efficiencies versus legacy systems. Our coding a benefit takes minutes, not weeks. System software changes in Judi takes days. Legacy systems, this can take months. Special customer requirements are achieved in Judi. And in legacy, you may never get your special requirement built. I'm going to turn it back over to you, Jillian. Do we have any questions?
Yeah, let me see what's coming in here.
Yeah, let's take a look.
Okay, so the first question I have, as a health plan, we rely on the ability to research claims on our own. How does Judi make that easier for those of us who do not have much experience being in an adjudication platform? So I can take this one. That's really a great question, and one asked often. You all heard how much I absolutely love our reasons for adjudication feature that returns on all claims in Judi, whether they're paid or rejected. As a user who might not have much experience with claims research or really being in an adjudication platform, Judi does make it easy to navigate and perform a claim search. Each adjudicated claim, whether it's paid or rejected or reversed, has a story of how that claim processed in Judi and what influenced the overall outcome. This really allows just an unseasoned user to know the exact rule sets and the claim, what the claim processed against, as it's in a format that really any user can read and understand. Next question. Jeff, I'll give you this one. So how does Judi address government programs?
Sure. So, we do, as we said, we have the ability, we do it today. We're processing all the different types of government program plans. So Medicaid and Medicare exchange, as well as commercial. Judi like you said, pre-configured. So we walk through and we know, so we can help the customer, guide them through that benefit setup for those government programs. So today, if you use Medicare or Medicaid for claims processing, you'll go to Judi, you'll use the workflow to configure your benefit. So if you select the type of plan that you're doing, Medicare, it will Medicaid. If you select Medicare, it'll come up with, or do you want to configure an MAPD plan, a PDP plan, a defined standard, an enhanced alternative, an actuarial equivalent, an EGWIP, an MA only plan, for instance, and Judi will present you with the workflow to configure that plan. Once you've configured that plan and you go ahead and test that plan and put that plan live, we already are ready then with all the ancillary processes around that. So PDE records are going to happen, FER transactions are going to happen, NX, all the other plan finder and encounter, if it's Medicaid files, will already be configured for you and ready to go as well. Anna, I think we're coming up on time. Do you want to should we take one more question, or are we ready to wrap up?
I think I have one more I can get to. Let's see. What does client access look like? Is it the same as a member of Capital RX, or are there different levels of access? So it's a great question. Judi has the ability to set up users with a variety of different access levels to your benefits. So whether it's a health plan's call center population that requires full access to member level detail, for example, and their information, or maybe just only access to certain groups of members, Judi can accommodate that custom access. If a client wants to build and manage their own benefits, for example, they'll have full edit access through our self-service model. Judi can most definitely support that. Say there are a subset of users that just require very specific niche VIP access to specific members and groups only. We can manage this easily in Judi. And I think we might have time for one more question, Jeff. Let's see. What does Capital RX's PDE process look like?
Yeah. So at Capital RX, we do have a fair amount of automation around that. So, like I said, we do calculate all the PDE values at point of sale. So when a claim adjudicates in Judi, not only are the responses in the D0 sent back to the pharmacy, but we also calculate all the values that need to be that populate a PDE record at the same time. So you immediately can look, as soon as the claim processes in Judi, at the claim and what was the disposition of that claim to point of sale, and attached to that is the PDE record with all the data elements filled out there. You can also see whether that PDE record has been sent to CMS, is pending response from CMS, or has been accepted or rejected or informational from CMS in a response. So as that goes through that life cycle, the database is updated continuously. Our operations folks have an operations section within Judi where they create PDE files and send PDE files and retrieve PDE files from CSSC, and then that is updated continuously as well, so that they can see what the disposition of their file is. This one has been sent, this one's been returned, and it keeps track of all the dates and the times associated with that. So using those processes, we've had really good success with PDEs. It's been, I think that, again, it does fall into that what you know now you wish you knew then. I mean, it is a very mature process that we have been able to build right into Judi and make it easy for users and for plan sponsors.